Hi, everyone. Thanks so much for joining us for a special Ask the Experts Facebook Live for blood and marrow transplant survivorship. We also have three Moffitt experts from our BMT and cellular immunotherapy survivorship clinic here today to answer all of your questions and share the latest on this topic. Joining me are Dr. Rawan Faramand, an oncologist in the BMT and cellular immunotherapy department here at Moffitt, as well as Leo Malpica, a nurse practitioner in the BMT department, and Jasmine Cherry, a cell therapy technologist and a leukemia survivor. Thank you all so much for being here today. Before we get underway, just a few quick reminders for our audience. Please submit your questions in the comments section, and we will do our best to get to as many as possible. Also, please keep in mind we cannot offer personal medical advice or make a diagnosis via Facebook. Additionally, Facebook is a public forum, so any comments or questions asked here are visible to the public. So with that out of the way, we'll get into the questions. Dr. Fireman, I'll start with you. Which cancer types typically require a bone marrow transplant?
That is an excellent question, and that's an area that's evolved in the last couple of years. So traditionally, bone marrow transplant has been used for patients with blood cancers, for example, leukemias, lymphomas, and multiple myeloma, but that now has expanded to also use bone marrow transplant as a treatment for patients with autoimmune disease. For example, lupus is one of the indications for transplant as well.
And Leo, could you go into cellular immunotherapy? What exactly is that?
So there's different types of the main one that's we currently work with or it involves taking the patient's cells, particularly the T cells, and those are then engineered to better target the patient's cancer. So the cells are collected a few weeks, sometimes a month or more prior to the actual treatment. They're sent to a lab where they're manufactured and turned into those CAR T cells, is what we call them, to better target the antigens on the cancer cells.
And the big topic of today is survivorship. Jasmine, I want to chat with you. We did mention off the top there, you yourself are a leukemia survivor. So can you share with our audience about your survivorship journey?
Yeah, absolutely. So I'm super excited to be here first off and discuss survivorship and just how important and valuable it is to all of us. So I work at the cell therapy and gene engineering facility here at Moffitt. And at our lab, we create a variety of cell-based treatments, one of them being bone marrow transplant. And I actually became one of those patients in 2022. I was diagnosed with acute lymphoblastic leukemia or ALL when I was just 25 years old, just 1 year into working my dream job here at Moffitt. And ultimately, I received an allogeneic bone marrow transplant in December 2022. It's actually made by my coworkers, which is really insane to like say out loud. And my little brother was actually my donor, so that was really awesome. And that experience really changed everything for me. But I'm happy to say that I'm in remission now, and I'm now in the survivorship phase, which definitely comes with its own unique challenges. So now I'm just a huge advocate for these topics, especially those that affect the AYA demographic or adolescent young adult, which is basically anyone between 14 to 39 that was diagnosed. So thanks for allowing me to be here today. I'm really excited to discuss.
Of course, and thank you so much for being willing to share about your experience and your story. If you're just joining us, we have Moffitt's BMT and cellular immunotherapy specialists here answering your questions about survivorship. So please feel free to post your questions in the comments section below. So let's talk about survivorship. Just give me Dr. Fireman. We'll start with you, and Leo and Jasmine, if you want to weigh in. Just what is survivorship in the overall picture of what we do here at Moffitt?
Sure, that's a great question. And when patients are initially diagnosed with cancer, it's a very scary and overwhelming time. So, of course, the initial goal of treatment is focused on curing the underlying cancer. But I think it's equally important to also focus on survivorship or long-term care of our patients who are cured of their cancer. And even if they're still fighting the cancer, it's still very important to make sure that we're taking care of the whole body and not just focusing on cancer care. So survivorship care looks at patients more holistically. We address both physical problems that can occur as complications from these cancer treatments, but also psychosocial issues that will also come up, as Jasmine mentioned, specifically in patients who are young adults who can face their own set of challenges, for example, financial concerns or ability to go back to work or any sexual side effects that may happen as a result of treatment. I'll leave it to Leo and Jasmine to add in as well.
Yeah, so I think what I'll add to that is like you have, the term survivor and then survivorship, and like Dr. Faramand said, survivorship is a whole other side that essentially starts like a diagnosis and continues through the patient's life, covering those other aspects of the diagnosis, so not just the cancer, but the physical, emotional, mental aspect of it, and helping patients get the most out of their treatment, getting back to their life as much as possible. So whether that be school, work, and or anything that they were doing prior to the diagnosis.
Yeah, I think you guys both said that really well. I think for me, the biggest thing was once I got my treatment, I thought that everything was going to be done. But then there's like a whole nother just journey, like after being treated. It's got a lot of like invisible healing, I like to call it, because it's like you're better now, but then there's a lot of things to kind of like trust your body again and just reconnect with your life now after cancer.
All great points. Thank you all for weighing in. Jasmine, I know you were particularly excited to talk about Moffitt's AYA services. Mentioned that's our adolescent and young adults. So, what sort of resources are available for patients that fall into that age range?
Yeah, so AYA, like you said, adolescent young adults, basically anyone that was diagnosed with cancer between the ages of 14 to 39, 15 to 39, I think. But the way I like to think about it is basically we're like too old for the kids table, but not quite ready to retire yet. So there's a lot of like unique challenges that come with being an AYA, like fertility, hormone replacement therapy, relationships, and career things. But the AYA program here at Moffitt has just been like a lifeline for me because not only does it give you a community of people that can relate to the challenges that we face, but there's a lot of resources that they provide us in monthly newsletters, some recommendations or like Stupid Cancer. It's a website, stupidcancer.com. They have a lot of great resources for AYAs. There's this other organization called Elephants and Tea, First Descendants, but all of these groups were brought to me by the AYA facility, I mean, a community that here at the group of Moffitt. So it's really awesome, and it just kind of helps us find support and resources for navigating life post-cancer.
As a great resource, and it's very, very good that we have that here at Moffitt. Thanks so much for sharing more about the AYA program. We are starting to get a few questions from the chat. One of our viewers asked, is there any future risk associated with, I hope I pronounced this right, filgrastim used to stimulate cell production in bone marrow donors? Dr.
I
Faramand,
can
you look
take
like
that
you might want to take
question.
that one.
Yes, so we are extremely grateful for our bone marrow donors. So the vast majority of our transplants are done using volunteer, unrelated donors who are part of the International Registry Program. So I'll put in a plug for bethematch.org because it is truly life-saving therapy because not all of our patients have an available related donor available. And one aspect of donation is getting filgrastim injections. The other name for it is Neupogen or GCSF that can stimulate the stem cells to leave the marrow and go into the bloodstream. So that way we can collect the stem cells with this process similar to donating blood. It's just much longer and it's more complicated on our side. So with Neupogen, when it's used in short periods of time, like we do so for donors, there are no associated long-term side effects from that medication, and that's why we deem it safe even for volunteers. There are a few short-term side effects, mostly like body aches, pains, sometimes fevers and headaches that we counsel the donors on extensively at the time that they agree to donate, but no concerns about long-term safety.
That's great. And thank you, everyone putting questions in the chat. We certainly appreciate them. That's why we're here. Um, Going back to survivorship, how does someone get into the survivorship clinic? Leo, I'll start with you.
Yeah, so as far as getting into a survivorship clinic, so it varies across institutions, at a national and even global level. But here at Moffitt, typically the patients are referred from within. So I'll start with the within process, right? So they go through the stem cell transplant process or cell immunotherapy. And then once the patients, like those immediate toxicity issues, things like graft versus host disease, um, engraftment. These things are under control. They're referred to the survivorship clinic by their primary doctors. So for the on the stem cell transplant side, it's anywhere after 3 months usually, but it could be at any time after the transplant period. And for the CAR T patients, currently starting at 12 months after that. But again, this is a referral that comes from the primary transplant or cellular therapy doctors. Now, we do have patients that relocate from other cities, other states, and they have their treatment somewhere else. So those patients, as of now, we have them established with their doctors here, and then those doctors make them the referral if they feel like it's adequate, appropriate for the patient.
Fantastic. And we've got some great questions coming in the chat. The next one I will ask is, what are some of the top clinical trials at Moffitt in cellular immunotherapy right now? We love promoting our clinical trials here. Dr. Faramand, what can you share about that?
Sure. So we have a ton of clinical trials that, again, we're very excited about because that's the way that we can change the future and improve outcomes for our patients. So in terms of trials, it really depends on the underlying disease. So there are specific trials for patients with large B-cell lymphoma and multiple myeloma, as well as clinical trials for acute lymphoblastic leukemia, all in the CAR T space. We also have several BMT-specific trials for prevention of graft versus host disease and for both treatment of acute and chronic graft versus host disease. So on the Moffitt website, and I can provide a link, we have a whole slew of clinical trials that are available. We're always happy to see patients and assess for eligibility for clinical trials.
Another question we got in the chat was, how can you become a donor? Jasmine, I know you had a donor. It was a family member. But if somebody wants to become a donor, what do they need to do?
There's actually a registry if you want to just sign up. It's NDM. I forget the acronym.
BeTheMatch.org.
Be the Match. I was like thinking the bigger term. Yeah. So BeTheMatch.org, you can absolutely sign up. It's a beautiful thing to do. I was blessed in the fact that my little brother was actually a match for me, but definitely that would have been an option that I'd have to look at if my family wasn't the option for me. So yeah, that's awesome. Definitely. Yes. That's awesome.
Fantastic. And if you are just tuning in, we have Moffitt's BMT and cellular immunotherapy specialist here today answering your questions about survivorship. So keep those great questions coming in the chat. Just a reminder, we cannot offer personal medical advice or make a diagnosis via Facebook. Additionally, it's a public forum, so any comments or questions you ask are visible to the public. The next question we have coming in from the chat. What are the most long-term, or what are the most common long-term complications facing BMT survivors, and how often should patients be seen in the months and years following their transplant? Dr. Faramand, I'll give that one to you.
Sure. So I'm actually going to pivot that to Leo because he's the one who sees all of our survivorship patients, and then I will discuss some more when he's done.
Sounds good. Take it away.
So just to repeat the question, yes, a very good question, but I think what is the most common
Long-term complications.
long-term complication? Okay, so as far as a bone marrow transplant, it kind of depends if you received donor cells or allogeneic transplant, or if it was autologous stem cell transplant. So on both sides, there's gonna be some issues related to the treatment itself in terms of organ toxicity. And depending on the specific chemos that you received during the transplant and even prior, that can affect basically any of your organs, some more than others, depending on the type of treatment. With the allogeneic side, we do tend to see a few more complications just because of the risk for graft versus host disease. And just to expand on that a little bit. So graft versus host disease is when your donor cells essentially attacks the recipient cells because it's recognizing it as a foreign thing. And it's almost not quite, but almost like an organ rejection. And then there's treatment that is given prior to there's treatment that is given to prevent this, but some patients do develop it and then need additional medications or changes in their regimens. But that's one of the potential long-term issues that can occur in regards to the organs. So some chemotherapies, like I said, can affect specific organs more than others. So some patients may need longer follow-up in terms of like cardiovascular or heart disease monitoring for the lungs. Whether they receive specific chemos that affect the lungs more than others, such as like bleomycin, or they had radiation. And then, so it really, this is where it becomes individualized. So because the risk and issues is gonna vary by patient, depending on the treatment that they receive. But in general, you tend to be just a higher risk for some complications. So it's good to have the survivorship evaluation to see specific treatments that were given to best direct what kind of monitoring needs to occur in the long term.
I agree with Leo completely. It's a very comprehensive answer, and that is why we think it's so important for our patients to establish care in the survivorship clinic, because it really is individualized, personalized care. In terms of the most common side effects that my patients report in the clinic, early on, it's a lot of fatigue and brain fog that I'm sure Jasmine can speak about some more. But other long-term side effects that we worry about are infections and a weakened immune system. And that can be frustrating for patients who can be potentially cured from their cancer and they want to go out and live their life as normal. But we do recommend some precautions, especially early on post-transplant, because of the higher chance of infections, and those infections can be serious. We also worry about the risk of secondary cancers, which sounds ironic that we are trying to treat a cancer, and then unfortunately, our treatment and chemotherapy can also increase the risk of secondary cancers. So we have to be very vigilant about secondary cancer screenings. There's also hormone dysfunctions that we can see. So like ovarian insufficiency or premature ovarian failure. We also see a lot of thyroid problems post-transplant. And we see bone loss, such as osteopenia or osteoporosis. So those are all aspects that we like to address both in our transplant and CAR-T clinics, as well as survivorship clinic. I hope that answers that question.
Yeah, and actually, something you were just talking about at the end there kind of leads into another question we're getting in the chat. How does BMT affect fertility, and are there any options for fertility preservation?
Sure, so I can go ahead and take that and have the others join in as well. So depending on the type of chemotherapy that we recommend for either the stem cell transplant or CAR-T, unfortunately, many of our treatments can cause infertility and a lot of hormonal fluctuations after our therapy. So our first recommendation is to always discuss fertility concerns with your physician. We like to refer patients for fertility preservation prior to starting treatment to give them the best chance of conceiving if they are planning to have a family in the future. So it's always a great resource to talk to your physician and get an early referral for fertility preservation. That can be costly at times, so there are some grants that we can recommend to help offset some of these costs.
All right, and the next question we have in the chat here are what services are available for BMT survivors, specifically psychological or social support? Jasmine, do you want to take that one?
Oh yeah. So the social work department is really great. They give us a lot of resources that like once you're feeling better, you definitely will like, realize like they're there. Um, like I said earlier, I know I keep saying it, but the AYA is really great. But we also have a lot of different support groups, even for caretakers too. So family members that are involved with because I always say like cancer is a family disease. It's not just you, like the whole family's feeling it. And we're all like kind of grieving together. So there's also other resources that I know my mom and my boyfriend, they got to do this like therapy for like caretakers, which is really helpful. Um, and then there's a really cool arts and medicine program, but I think there's a website, or on the website for Moffitt, I think there is like some subpage for different resources depending on what you're looking for.
And we're happy to share some of those resources in the chat for any of our viewers. Thank you, Jasmine. Next
Mhm.
question we have, kind of along the same lines, is there a specialized workbook for long-term survivors that can help outside healthcare providers understand expectations, any effects, and what tests may need to be done that may not be done for non-transplant patients? I know that was kind of a mouthful.
Yes.
Uh,
As far as non-transplant patients, the and the NCCN, National Comprehensive Cancer Network, has a section specific for survivors and things to look for. And then break it down by disease as well. So someone who hasn't had a transplant or cellular therapy, they can go in there, and then it's very detailed and have a ton of resources in terms of what to look for if they haven't had a transplant specifically or cellular immunotherapy. And I believe the Lymphoma Leukemia Society is going to have some resources as well. The International Myeloma Society or Myeloma Working Group should have some of those as well, specific to myeloma related things.
All right, thank you, Leo. If you're just joining us, we have Moffitt's BMT and cellular immunotherapy specialists here today answering your questions about survivorship. So keep those questions coming in the comments section. We've got a lot of great ones so far. And another one I want to get to. Jasmine, I'll give this one to you. What advice would you give someone going through cancer?
I think my biggest thing would be to give yourself grace because the process is incredibly demanding and healing definitely isn't linear. You're going to have good days and you think you're doing good, and then you have a bad day. Um, Someone gave me really good advice one time. He told me that it's a marathon, not a race. Because I feel like we're just kind of like looking forward to just getting over it, but definitely like ask questions also, advocate for yourself, allow other people to help you. Um, so yeah, that's probably what I would tell someone. Because your body really is doing something extraordinary whenever you're getting these treatments, but it definitely is very taxing physically for sure, and then post mentally definitely as well.
Yeah, I think this is a great one for everyone to weigh in on. Dr. Faramand, if you want to go, what advice would you give to someone with a cancer diagnosis?
I agree with Jasmine completely. We really want to empower patients to advocate for themselves, to ask questions. We want to treat the patients holistically and not just focus on the cancer. So it's really important for us to understand the goals of each patient because everyone is very different and everyone has different goals. And it's great to, connect with our patients and their families and caregivers because it takes a village to really heal. So we like to involve as many people as the patients would like us to involve and really come up with a plan that is really personalized for each patient. So my big advice is really just advocacy questions and making sure that, we do the best by the patient and that everyone is different.
Leo, anything you want to add?
Yeah, so I just to emphasize the whole thing about resources, because the process can at times be isolating, especially early on when you're immunosuppressed, your counts are low, and your immune system is recovering, and you don't want to talk to anyone, you don't want to go out, you're staying at home. So it's good to have these resources and support groups that you can access from home or really anywhere you are so that you stay in touch with a community that can help support you, not just the patient, but also the family, like Sherry said, or Jasmine, sorry, um, said as far as it affecting the whole family. So caregivers can also, it can take a toll on their physical and mental health because they're taking over a lot of the responsibilities, managing medications. So having a lot of the some of the resources that were posted, like BMT Infonet, Lymphoma Leukemia Society, they have a section specific for caregivers that they can access as well to help get through the process and have support. And reaching out, ask questions if you have any concerns or need for social work, psychology, psychiatry. Reach out to your team. doesn't have to wait till you have a scheduled visit. And at any time you can reach out and ask questions, and so that we can help point you in the right direction.
Yeah, and along those lines, if someone is experiencing anxiety or depression or mood changes, what should they do?
So you know, I often tell our patients that we can all have great questions, because it comes up a lot. So we all have, a bad day, a bad week. If it's something that turns into weeks or months, then you definitely want to talk to someone. So any type of counseling, we have great social work team here, especially within the BMT department. But Moffitt in general, social work, it's a good place to start. And then they can help provide referrals as far as psychology, psychiatry, support groups. Outside of that, just talking to a family member, talking to a friend, not bottling up, is something that's going to be helpful. Making sure that you're getting good sleep, staying active, so out of that bed, out of the couch, and really talking to someone. There's of course medications to help manage these things, but I personally don't like starting with pharmacotherapy unless it's absolutely necessary. And instead trying to start with those other things, talking to a counselor, psychology, psychiatry, and getting that help and extra tools. So medication is one tool in your box, and then the counseling is gonna be another tool in your box. You're not gonna go fix a car with a wrench, is the example I give. You bring a whole toolbox. And then things like meditation, yoga, breath work. We do have the Healing and Wellness Center here at Moffitt that our patients can access for free. It doesn't have to be someone who received like a transplant or cellular therapy. If you're having treatment at Moffitt, that's a good place to start in terms of meditative work and practice and beginners level yoga.
And the term support group has come up a few times in our conversation here, and we were getting a question in the Facebook chat. And I'll ask you, Jasmine, this support group, is that specific to the BMT Survivorship Clinic, or is it a general support group?
It's a general support group. So anyone that has had a cancer diagnosis in that age range for AYA. And there's also other support groups, and there's also online support groups. I've joined a couple on Facebook that are really awesome. There's this one that I really love. It has a really long name. It's like Sexual Health for Women that have had like any fertility issues, because that's definitely a big thing, at least for me in my survivorship, was dealing with going into early menopause at 25 and having to deal with all of those symptoms before my own mom. My mom's not even in menopause yet, and I'm like telling her the things that come with it, because it's a lot more than hot flashes, and I feel like we don't talk about it enough when it comes to um, what happens like when your period stops. So I'm really glad I got into those support groups, because they really helped me figure out like what to do next in order to feel better. And still a journey, but I'm definitely feeling a lot better than I did 2 years ago. So yeah.
Well, that's great. We're certainly glad that you're feeling better. Sticking on that topic of family, one of the questions we received: what kind of testing must family members undergo to determine if they are a match for a relative who needs a transplant?
Sure, so that is a great question. So typically we do a test called HLA typing that can be done either as a blood test that we can perform here at Moffitt, or we send a kit to the family member's home to do a buccal swab, so just a cheek swab, to determine if they are indeed a match or not. So each sibling has about a 25% chance of being a full match and a 50% chance of being a half match. And these half match transplants now do very well, called haploidentical transplants. So we're able to use them for many patients.
And speaking of transplants, this term had come up a few times earlier in the chat. I believe it was allogenic transplant. What type of transplant is that?
The allogeneic stem cell transplant means that it says transplant from a donor, so from someone else's stem cells. And autologous stem cell transplant is using your own stem cells.
Thank you so much for clarifying on that. Going back to the chat, a ton of good questions. Please keep them coming. Thank you, everybody, for for contributing. What are some healthy habits survivors can build during survivorship? Leo, do you want to take that one?
Yeah, so as far as that's very good question. So some sort of along the lines what I was saying earlier is staying active. So as much as possible within your limitation of that fatigue that happens on the initial post-treatment period. You definitely want to stay active, stay out of the couch, stay out of bed, socialize within reason, right? So if you're very, suppressed, immunocompromised, you don't want to be in crowds, but you still want to engage with at least family members or those living with you. You want to try to optimize your sleep as much as possible, making sure you're hydrating well, that you're eating good amounts of protein. Protein is something that our patients lack a lot of, and something that your body needs more of. So your caloric demands increase when you're going through treatment and even after treatment to recover from all the muscle loss and things that happens after the treatment. So those are a few things. Try to avoid like the processed foods, uh, pro-inflammatory things. But if I was gonna narrow it down to two, it would be staying active and stay engaged with your family and your support group. Yes.
Yeah. Jasmine, as someone who's been through it, what healthy habits did you try to pick up along your survivorship journey?
Yeah, so I would say like the first year was really tough because I was inpatient a lot, so like my muscles like atrophied. Like I had to do physical therapy after because I couldn't even like tie my shoe and like stand back up. It was really crazy. So for me, it kind of started when I did Miles for Moffitt. I did it I think 2 years ago for the first time ever. It was like my first time ever doing any type of 5K race. And I have never been a runner, like never, but something like, I don't know, some like running bug bit me. And now I'm like, me and my boyfriend, we do all kinds of 5Ks. I really look forward to it. So I don't really run them. He runs them. I kind of just have a little party with my headphones and jog and walk and kind of go there for the free stuff. But it's definitely been a habit that I built that has been really transformative, especially for my mental health, which is really like people say that, but it's honestly true. Like, just moving in some way like really, really helps. And when you're inpatient too, as a BMT patient, the physical therapist will come and they tell you to walk a mile a day, and it's like 11 laps around like the ward, and you're just like, I'm not doing that. But it is so true though, because like walking helps with everything. Even after you get your bone marrow biopsy, they always tell you, hey, if you move, you'll heal faster, and it's true. So yeah.
That's a great opportunity to plug Miles from Moffitt. It's November 22nd this year in
Yes.
downtown Tampa. I've done it twice, two or three times myself
It's so
personally. Always,
fun.
it's the best.
The energy is amazing. And also cooking, because you watch a lot of cooking channel. There's like three channels you can watch, HGTV and the cooking channel. So for me, I think that cooking has been a really kind of, I guess it's kind of healthy, right? Yeah, I cook healthy stuff. So cooking has really been really a big thing for me now too.
Yeah, and we have nutritionists here at Moffitt that there's resources available. If you do want to, you know, make sure that you're cooking and eating the right things, right?
Hmm.
Dr. Fairman, I saw you unmute. Did you want to add anything there about the cooking?
And no, just that I support it fully. Nutrition is a huge part of recovery. And like you mentioned, we do have excellent nutritionists who also see all of our patients when they're inpatient in the BMT unit. And then more than happy to see our patients in clinic as outpatients. They even offer Zoom appointments as well for our patients who live further out. So it is a great resource to take advantage of, as well as physical therapy. Like Jasmine mentioned, we do have them inpatient, but we can also refer patients to physical therapy here at Moffitt or provide referrals to places closer to home if they're not able to make it here.
All fantastic resources. If you're just joining us, we have Moffitt's BMT and cellular immunotherapy specialist here today, answering your questions and comments about survivorship. So be sure to keep them coming in the comments section below. Just a quick reminder, we cannot offer personal medical advice or make a diagnosis via Facebook, and Facebook is a public forum, so any comments or questions are visible to the public. So getting back to the chat, are there any new advances in BMT that are likely to improve outcomes for patients? Dr. Faramand, I'll give that one to you.
Sure. So we have been very lucky to witness many advances in the past decade. One of the biggest advancements has been the way that we prevent graft versus host disease with a medication called cyclophosphamide. That has allowed us to use alternative donors like half-match donors or even donors who are not a full match. That has expanded the ability of us to offer transplant to many more patients because traditionally ethnic minorities were not able to find a full match for them in the registry program. So this way we're able to offer a donor for the vast majority of patients using this regimen to prevent graft versus host disease. Along those lines, there's been several recently approved FDA medications for both acute and chronic graft versus host disease, which is the big complication of transplant. And as mentioned earlier, CAR T-cell therapy has really taken off. We do a lot of CAR T-cell therapy here at Moffitt, and we also participate and also develop our own clinical trials to really push the science forward. And we've been really amazed of how well CAR T-cell therapy has worked for many of our patients, and that's a field that continues to evolve.
Now, I heard you mention it a couple times. I'm just going to call it GVHD. Can you just give our audience a quick explainer of what that is and who might be at risk for that?
Sure. So graft versus host disease is what happens when the cells from your donor can start to fight against your own cells. So it is a complication only of allogeneic stem cell transplant. So it's not something that we commonly see in patients with autologous stem cells, their own cells back, or with CAR T-cell therapy. And that can involve every single organ because these are stem cells, so they can go everywhere. In the first few months of transplant, we worry about graft versus host disease impacting the skin, the gut, or the liver. But we also worry about long-term chronic graft versus host disease, which can really impact any organ site, which is why we continue to follow patients in our transplant clinics and in survivorship, even years after they complete therapy, so we can evaluate and hopefully identify these complications early so we can offer the best treatments for them.
Down the road, if you relapse after treatment, what then are the options?
Sure, that is an excellent question as well, and it really depends on what the underlying diagnosis is. So, for example, for patients with acute lymphoblastic leukemia or ALL, we have 3 FDA-approved products for CAR T-cell therapy for patients with relapsed disease, and many of these patients we can treat successfully. That is also goes for patients with multiple myeloma, where we have FDA-approved CAR T-cell therapies for relapsed multiple myeloma and lymphoma. For patients with other blood cancers, such as acute myeloid leukemia and myelodysplastic syndromes, there are clinical trials that we can offer through our malignant heme group, which are a wonderful department here at Moffitt as well, and we work very closely together. So even if patients relapse, which of course we don't want to happen, but it is still something that happens after CAR T and after bone marrow transplant, we can still offer treatments either as standard of care or in the context of clinical trials.
Great information. Next question in the chat. Jasmine, I'll give this one to you. How do I explain survivorship to friends or family who think I'm all better?
Um, I love the word. Someone told me this. It's invisible healing. So, like, yes, your cell counts are back to normal and you're, clinically in remission and everything is good. But I think that there's a lot of components that people don't see. So, like, especially if you have like the fertility route. So, if you're now like infertile after treatment, um, your hormones are not the same. So, there's, hormone replacement therapy that we have to consider. And then there's also this kind of like you have to learn to trust your body again because it's really this weird, it's kind of hard to explain, but you have to kind of like reconnect with yourself because it's kind of like this pause that's put on your life. And it's honestly like a sort of grieving. You're kind of grieving your old life and like the way that things were, especially if you're in like a relationship, things are a lot different now. Before treatment, I was just a normal, like in my 20s, and now I have to put estrogen cream on my arm every day, and I have to do pelvic floor therapy, and I have to also just think about, if I have a life without children. I was able to freeze a few eggs, but at the time I was already sort of in ovarian failure. So they have a few eggs in the freezer, but I do also have to think about like what my life would look like if I'm not able to have children. And also I'm not able to have them naturally. So I'd have to do like IVF and what that looks like. And then there's also some like things of like PTSD. Like you usually don't think about PTSD like for like a diagnosis of like chronic illness, but it's a real thing. So I definitely have a lot of triggers now that I didn't used to have. I think working here is definitely a blessing and a curse because I have my good days, but some days I definitely do feel like it's very heavy. Just having like the experience of being beyond the lab coat, like in the patient chair, that also now working with patients every day and trying to grant them that second chance. But yeah, it's just a lot of things. For me, definitely has been like the fertility part. It's really scary to think about because at the time I was not ready to have kids, but now that I'm older, I'm like, well. It kind of sucks now, but it's definitely something that it happens really quickly and you don't think about it until you get to survivorship. Because now that you're thinking about life again, you have to think about all the things that you were just signing when you were like ready just to feel better. But now it's like, okay, now I actually have to think about getting the annual cancer screenings to make sure that those secondary malignancies don't occur. And I'm always scared whenever I get a cold or something. I'm like, is this a flu or is this something else? So it's definitely a lot of ups and downs when it comes to survivorship, but it's also, I'm really grateful to be here at the same time. So you kind of feel guilty, but yeah, it's really complicated.
Well, we certainly appreciate you being willing to share your experience on such a complicated topic, and hopefully, if someone's going through a similar situation, they can relate to you and find some inspiration in your ability to power through.
There's a great book that I recommend. I don't know, Jasmine, if you've ever read it. It's called Between Two Kingdoms, and is about a patient. It's a memoir who had acute myeloid leukemia and then underwent a stem cell transplant, and that's why it's named Between Two Kingdoms because you're in between like the diagnosis and then trying to like re-enter quote unquote normal life, even though like life as you know it before cancer it's very hard to ever get back to that. So it's like a new normal that we expect patients to have after cancer treatment. As much as we want everything to be 100% back to normal, I think it's very difficult to do that. And it's important to set that expectation early on. But it's a great book. I learned a lot about it just hearing things from a patient standpoint. And that's why it's so important that we talk to our wonderful patients like Jasmine, because oftentimes we think of things from just a clinical standpoint and we're looking at numbers and diagnoses, but it's equally important to look at the patient and hear from them what's important for them. And that's why many of our new and recent clinical trials incorporate things like patient-reported outcomes because the voice of the patient is equally important.
You- Something you mentioned there reminded me of a lot of the BMT patients that I've met. They celebrate a new birthday.
Mhm.
Can you explain a little bit about what, why that is and how that works?
Jasmine or Leah, do you
Oh,
want to take that?
yeah, I can. Yeah, so I actually, it was kind of crazy from my first birthday. So your day zero, the day you receive your cells, is kind of, they treat that as your new birthday. For a lot of different reasons. One of the reasons that was really interesting to me that I didn't know before I got transplant is you actually have to get revaccinated again. So you kind of like have these little milestones, kind of like a baby, and you get like your vaccines that a baby would get at like 6 months and 1 year. And for my first birthday, so in 2023 of December, my coworkers actually threw me a birthday party. It was really cute because they said I turned 1 years old and I got my 1 year old shots and there's all these milestones. But I know that the big number is 5. Once you hit 5 years post-transplant, the chance of relapse dramatically reduces. So right now I'm 2.5, so I'm on my way there. I'm really excited. But yeah, it's really crazy to think that your immune system kind of has to start over again. But I kind of like to think that I'm like 20. My little brother's 20, so I'm like a little 20-year-old, got those stem cells in me, so feel a lot younger now.
Oh, that's fantastic. And one thing we had mentioned before, you're worried if you catch a cold or something. A couple years ago, we were all wearing masks all around town, but for BMT survivors, masks can be a pretty common part of everyday life, right?
Yes.
Yeah, so
So
well before COVID, masks were very popular in our BMT world. So that was something that we standardly recommended for our patients who just had transplant early on because of that risk of infection. So that was a recommendation well before the COVID pandemic.
we've got time for a few more questions here. We have our BMT and cellular immunotherapy specialist answering your questions about survivorship. So get to one or two more before we run into time here. Leo, earlier you had mentioned some organs that were at risk for maybe treatments like chemotherapy. What about CAR T therapy? Are organs at risk to that kind of therapy as well?
So yes, because it some of it has to do with the treatment that you're receiving or the chemotherapy in preparation for the stem cells, BMT or transplant or the cellular immunotherapy. But some of it also has to do with the treatments that you received prior. So for instance, someone receiving CAR T for lymphoma may have had several rounds of chemotherapy, in particular one called like anthracycline, that can affect your heart. So these patients are going to be a higher risk for cardiac complications. So we pay more attention to, well, in that particular case, we would pay more attention to the heart and making sure that they're getting regular checkups as far as cholesterol levels, blood pressures are under control. In some cases, they may need a referral to a cardiologist or cardiac oncologist for surveillance visits. So things like, if you had and things can compound. So if you have this anthracycline and then you have high blood pressure, diabetes, high cholesterol, these things increase your risk of developing things called like cardiomyopathy or heart failure or different irregular rhythms that need specialist evaluation with a cardiologist. And then, if you add things like radiation that some of the patients receive for lymphomas, if there's like mass on the chest, even more reason to see a specialist and have more close monitoring of those particular organs. But just to add on to this, in terms of like the chemotherapy and like radiation, and we've been talking a lot about AYA or adolescent and young adults. This is a particular population of concern because they receive this treatment at a young age. So, sometimes when patients are like, 40s, 50s, 60s, they're already doing things like mammograms, colonoscopies. So they're on a particular schedule, but our younger patients haven't had those things yet. But if they receive specific chemos or radiation, they're going to need these screenings sooner because it puts them at higher risk for things like colorectal cancer, breast cancer, the thyroid dysfunction that Dr. Faramand mentioned earlier, in particular with things like radiation or specific chemotherapy can increase their risk for certain thyroid dysfunction. And with I lost my thought here, but as far as the monitoring and organ related things, it really depends on the times and specific chemotherapy that you received.
Oh, great information. That is just about all the time we have for today. I want to give all of our panelists one last chance. Dr. Fireman, I'll start with you. What is the take-home message that you want to impart with our audience today?
Sure, I'm very happy to be here. We've had excellent questions from the audience. The key takeaway is that we want to offer patients the best therapy to cure their cancer while also taking care of them as a whole being. So definitely make sure that you talk to your care team, ask questions. We're here for you to provide the best care.
Leo, any final thoughts?
Yeah, so this is a process that you're receiving the treatment, but you're not alone. You have an entire team of nurses, physicians, the nurse aides, the doctors, social work. So it's a large team that's here for you to support you. In addition to that, any specialist that gets added on as part of your team. So it's not something that you're going through alone. And then just remember that you can ask questions at any point, reach out to anyone, engage in those support groups. And if not at Moffitt or anywhere, try to find some kind of survivorship program for the additional evaluation of some of these long-term complications that can occur. And stay active. Yes. like Sherry said, I'm sorry, Jasmine, I don't know why I keep calling you Sherry, but that physical mobility is really important for the not just the physical but the mental health and benefits that you get from that. So and a lot of patients struggle with the psychosocial and then the mental aspect of things that come after the treatment, and family as well. So get your family moving, get them involved in support groups, bring them to your visits so they can learn more about what you're going through. And if your friend wants to support you, bring them to the visit so they understand more too, as far as what you're going through and what you went through, and things to look out for, and cheer you on from a moral support standpoint.
All great points. Jasmine, we will wrap it up with you.
Yeah, I think my biggest thing is just to be kind to yourself and give yourself a lot of grace. It's definitely good to lean into the community because I think that there's a lot of power in community and having others to go through this with. And yeah, you're definitely not alone in this. I just think that Moffitt really gives a great space where we can have these conversations and laugh and cry and be seen without judgment. I've even had conversations in the waiting room with other patients. So yeah, so just reach out to other people, reach out to me. I'm always here as a resource. I'm an AYA ambassador. So if you know anyone that's been diagnosed around this age group, or even we call them our next levels, people that are not even 14 to 39, you can even be older if you're going through menopause. I'm your girl. So yeah, so that's pretty much all I have to say. And just thank you so much. It's really been a pleasure to be on this with you guys.
Oh, well, thank you all for being such great resources for our patients here at Moffitt. And thank you for answering these questions today. And thank you to everyone in our audience who joined and asked some fantastic questions. For more information on our BMT and cellular immunotherapy survivorship clinic, please visit moffitt.org.